Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about high cholesterol and krill oil, especially the omega-3 fatty acids inside it. Start with this question. When someone says, "My cholesterol is high," what exactly is high? Is it LDL cholesterol, the type strongly linked with plaque buildup in arteries? Is it triglycerides, the blood fats that often rise with excess sugar, alcohol, insulin resistance, fatty liver, obesity, and some medications? Is HDL low? Or is the total cholesterol number high because one part is abnormal? Why does this matter? Because krill oil does not affect every cholesterol number in the same way. And if you use it with the wrong expectation, you may feel disappointed, or worse, you may delay treatment that you actually need. Look at your lipid panel. Do not just look at the total cholesterol. Look at LDL, HDL, triglycerides, and non-HDL cholesterol if it is reported. Ask yourself, what number is driving my risk? Krill oil is an oil extracted from tiny marine crustaceans called krill. Its main active fats are EPA and DHA, the same two long-chain omega-3 fatty acids found in fish oil. But krill oil packages many of these fats in phospholipid form, while many fish oil products contain them mostly as triglycerides or ethyl esters. Why is that interesting? Phospholipids are part of cell membranes. Some studies suggest omega-3s in phospholipid form may be absorbed well, especially when taken with meals, although the real-life effect depends heavily on dose, product quality, and the amount of EPA and DHA per serving. Do this first. Turn the bottle around. Do not focus only on 1,000 milligrams krill oil on the front label. Look at the actual EPA and DHA amount. Many krill oil capsules contain much less EPA and DHA than people assume. The total oil amount is not the same as the omega-3 dose. Now, how can omega-3s help blood fats? The strongest and most consistent effect is on triglycerides. EPA and DHA can reduce the liver's production of very low-density lipoprotein particles, often called VLDL. VLDL carries triglycerides through the bloodstream. Omega-3s also appear to improve the clearance of triglyceride-rich particles from blood. In plain language, they may help the body put fewer triglyceride-loaded particles into circulation and remove some of them better. Why does that matter? High triglycerides are not just a number. When triglycerides are elevated, they often travel with other metabolic problems: small, dense LDL particles, low HDL, insulin resistance, abdominal weight gain, and fatty liver. Pay attention to this pattern. If your triglycerides are high, ask yourself, am I eating a lot of refined carbohydrates? Am I drinking alcohol frequently? Am I gaining weight around the waist? Is my blood sugar drifting upward? Omega-3 can support improvement, but it should not be your only move. Clinical guidance from heart organizations generally recognizes prescription-strength omega-3 fatty acids as a treatment option for high triglycerides, especially when triglycerides are significantly elevated. At around 4 grams per day of prescription omega-3, triglycerides may drop meaningfully in many people. But here is the key. That dose refers to EPA and DHA, or specific prescription omega-3 formulations, not simply one small supplement capsule. Krill oil supplements usually provide lower omega-3 doses. That does not mean they are useless. It means the effect may be modest unless the EPA and DHA intake is high enough, consistent enough, and combined with lifestyle changes. Think of krill oil as a possible supportive tool, not the main foundation of cholesterol management. Now let's separate triglycerides from LDL cholesterol. LDL is the particle most strongly targeted when doctors treat cholesterol to prevent heart attack and stroke. Statins, ezetimibe, PCSK9 inhibitors, bempedoic acid, and diet changes can lower LDL in measurable ways. Krill oil is not a replacement for these when LDL risk is high. Can krill oil lower LDL? the evidence is mixed. Some trials of krill oil show small changes in lipid markers, and some reviews suggest possible improvements in triglycerides and HDL. But LDL reduction is not reliable enough to treat krill oil like an LDL-lowering medication. In some people, omega-3 products that contain DHA may even raise LDL slightly, especially when triglycerides are very high. So if your main issue is LDL of 170, 190 or higher, do not assume krill oil will solve that. Ask yourself, why is my LDL high? Is it genetic? Is there a family history of early heart attack or stroke? Do I have diabetes, kidney disease, high blood pressure, smoking exposure, inflammatory disease, or a prior cardiac event? If yes, your treatment threshold changes. Get professional guidance. Do not use supplements as a delay tactic. Where krill oil may fit best is in a person with mildly to moderately elevated triglycerides, low intake of fatty fish, and a desire to increase EPA and DHA while working on diet, weight, exercise, sleep, and alcohol reduction. It may also fit someone who has trouble tolerating some fish oil products, although krill oil can still cause digestive symptoms. How should you take it if your clinician agrees? Start with food. Omega-3 supplements are usually better tolerated with meals, especially meals that contain some fat. Do not take a handful of capsules on an empty stomach and then blame your body for nausea. Start low if you are sensitive. Pay attention to reflux, fishy burps, loose stool, nausea, or abdominal discomfort. If these happen, try taking it with your largest meal, splitting the dose, or stopping and discussing alternatives. Look at quality. Choose products that clearly list EPA and DHA. Look for third-party testing when possible. Omega-3 oils can oxidize, and poor quality oils may taste or smell strongly rancid. Store them as directed. Do not keep a bottle in heat for months and expect the same quality. Now, let's talk about the deeper part, why omega-3s are not magic but still medically interesting. Atherosclerosis, the process behind many heart attacks and strokes, is not just cholesterol floating around. It involves LDL particles entering the artery wall, inflammation, immune cells, oxidative stress, blood pressure forces, clotting biology, and time. Omega-3s may have effects on inflammation and cell membrane signaling. They may affect platelet activity slightly. They may influence liver fat handling. But the size of these effects in real people depends on the person, the dose, and the baseline risk. So do not ask, does krill oil work? Ask a better question. What am I trying to change, and how will I measure it? If the target is triglycerides, check fasting triglycerides before starting, then recheck after about 8 to 12 weeks if your clinician agrees. If the target is LDL, krill oil is not the main tool. If the target is general omega-3 intake, because you do not eat fish, it may help fill a dietary gap. Do this, write down your baseline numbers: LDL, HDL, triglycerides, blood pressure, a 1C or fasting glucose if available, waist measurement. Then change one plan at a time. If you start krill oil, improve diet, begin exercise, stop alcohol, and lose 10 pounds all at once, your numbers may improve, but you will not know which factor mattered most. That is okay clinically, because the goal is better health, but be honest about what the supplement did and did not prove. Now, what lifestyle changes pair best with krill oil for high triglycerides? Start with sugar and refined starch, sweet drinks, desserts, white bread, large portions of rice or pasta, and frequent snacking can drive triglycerides in many people. Reduce alcohol, especially if triglycerides are high. Alcohol can push triglycerides up sharply in some patients. Add protein and fiber to meals. Use unsaturated fats like olive oil, nuts, seeds, and avocado in reasonable portions. Eat fatty fish such as salmon, sardines, trout, or mackerel if you can, and if it fits your medical situation. Move your body after meals. Even a 10 to 15 minute walk after eating can help glucose and triglyceride metabolism over time. For LDL cholesterol, focus on soluble fiber, replacing saturated fat with unsaturated fat, weight management if needed, and medications when risk is high. Foods like oats, beans, lentils, psyllium, vegetables, and nuts can help. Limit trans fats and reduce heavy intake of butter, high-fat processed meats, and large amounts of full-fat dairy if your LDL is elevated. Ask your doctor whether you need a coronary calcium score, advanced lipid testing, or medication based on your overall risk. Now, safety. Pay attention here. Do not take krill oil if you have a known allergy to shellfish or krill unless your allergy specialist or physician specifically clears it. If you take blood thinners such as warfarin, apixaban, rivaroxaban, dabigatran, clopidogrel, aspirin at higher doses, or if you have a bleeding disorder, talk to your clinician first. Omega-3s can have mild blood thinning effects, and while serious bleeding is not common at standard doses, the combination with medications deserves respect. If you are scheduled for surgery or dental procedures, tell your healthcare team about krill oil. Do not hide supplements, they matter. If you have atrial fibrillation or a history of rhythm problems, ask your cardiologist before using high-dose omega-3. Some large studies of high-dose omega-3 products have raised concern about atrial fibrillation in certain groups. This does not mean every small dose is dangerous, but it does mean you should not self-prescribe high doses. If you are pregnant, planning pregnancy, breastfeeding, have liver disease, chronic kidney disease, diabetes, pancreatitis, or take multiple medications, get medical advice before starting. If triglycerides are very high, especially above 500, the concern is not only heart risk, but pancreatitis risk. That needs medical management, not just a supplement plan. And if you have chest pain, shortness of breath, weakness on one side, trouble speaking, fainting, severe upper abdominal pain, or sudden severe symptoms, do not manage that with krill oil. Seek urgent medical care. In the emergency department, we do not treat active heart attack or stroke with supplements. We stabilize, diagnose, and treat immediately. So what is the practical takeaway? Krill oil can be a reasonable omega-3 source for some people. Its most believable benefit for high cholesterol patterns is support for lowering triglycerides, not reliably lowering LDL. It may help as part of a broader plan, especially when diet is also adjusted and omega-3 intake is low. But it is not a cure, not a substitute for prescribed cholesterol medication, and not an excuse to ignore your lipid panel. Look at your numbers. Identify the real target. Choose a product based on EPA and DHA content, not marketing. Take it with food. Recheck labs after a reasonable period. Watch for side effects. Talk to your doctor if your cardiovascular risk is high, if you take blood thinners, if you have rhythm problems, if you are pregnant, or if your triglycerides are very elevated. The best cholesterol plan is not built from one capsule. It is built from knowing your risk, improving the daily pattern, using medications when they are needed, and following the data in your own body. Take this step today. Find your last lipid panel and read every line of it. Ask, what is the main issue here? Then make the next decision with clarity. Thank you for spending this time with me. Stay careful, stay informed, and keep building your health one decision at a time. I'll see you in the next topic.